Hi guys. Okay, so we're going to do the study guide for quiz number 2, which is on week 9. The chapters that we're going to be going over are 23, 26, 27, 82, 88, 89, 89, sorry. Okay, this is what you should be looking for, this looking study guide. Okay, let's begin, okay? Make this real quick. And the most important function of albumin provides to the body and why it is important. Basically, albumin, it helps maintain osmotic pressure, which means it's going to help maintain that blood pressure. And then it's also going to help it's a colloid, so it's going to help thicken that blood. So it's going to help make it more like increase osmotic pressure, increase some blood pressure, and thicken the blood so you have adequate circulation. Got it. Okay, what occurs when bile is released from the gallbladder? It emulsifies fat in the part of the colon where 80% of water is absorbed. Proximal colon. Know the reasons why the portal circulation is considered separate from the systemic circulation. Basically, all the abdominal organs, such as the stomach, the intestine, the spleen, and pancreas, they first circulate through the liver and the portal vein, and then they go into the inferior vena cava. So they have their own little circulation, and then they go right back into the main body. What does hemoglobin do? It carries oxygen, and it picks up CO2 on the way back. Which disease we try to prevent in babies when we check for the Duffy antibody, which is the D antigen, erythroblastosis fetalis. How many people does it require to check a unit of blood? 2 licensed professionals. So if I was giving blood, I would check it, and I would have another nurse check it, or somebody else that's licensed to check it with me. What do you review? So the guidelines on page 1459. The most important thing is constantly documenting vital signs, especially temperature, and checking to see how your patient is. So what are colloid solutions, and what kind of situation would the nurse probably hang them? So colloid again is like albumin. It's like a thickening type thing, and you're going to give that to somebody who's experiencing hypotension from hemorrhaging. Okay, where is intrinsic factor made, and what role it has in the body? What kind of patients would have loss of intrinsic factor? So it's made from parietal cells in the gastric mucosa, so it's in the gut. It's helped with the vitamin B12 production, and usually patients with bariatric surgeries are going to have a problem producing it because their gut's just torqued with. Okay, catabolism. Know the definitions of catabolism, anabolism, and metabolism. You guys can look that up. Know one of the main functions of the pancreas. So pancreas, think diabetes. Basically, the pancreas has a big role in when it comes to insulin and glucagon, and helping regulate the blood sugars in your body. Okay. There's a diabetic neuropathy and diabetic nephropathy. Be careful not to confuse them. Be able to divine both. What is the main urinary complication when you see a diabetic nephropathy? So you guys can look that up, but neuropathy, think of that tingling numb pain. Nephropathy is kidney function, and you're going to be, basically with diabetic nephropathy, their urine's going to be more concentrated. Okay, know where erythropoietin is made and what disease would cause loss of erythropoietin. What's erythropoietin? It's made from the kidneys, hormones there kind of produce it. It helps then go to the bone marrow, which helps promote red blood cell production. And usually though, what's going to inhibit it is end-stage renal failure, because if your kidneys aren't working, they can't secrete the hormone to promote erythropoietin, which then can't be secreted in the body to produce more red blood cells. Then you're going to get anemia and blah, 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 cascading events. Okay, know what actually happens to the anatomy in each of the bariatric surgical procedures. You guys can look that up. There's a handout that I gave you when I gave all the other handouts out. It's a nice picture of all those different gastric surgeries. Just be familiar with what each one kind of looks like, and you'll be fine. Okay, name the blood test that detects pancreatitis. Serum amylase. What would a nurse see if she suspects someone is bleeding from a duodenal ulcer? Coffee ground emesis, which is usually also to describe a bloody emesis. Coffee ground emesis. Okay, what is the main test to confirm a kidney stone? It's called a KUB test. Look up the details. Define hydronephrosis and what occurs in this condition. Example, what happens to the urine in this condition? So that's when the blood flow is blocked, or the flow is blocked, causing kidneys to get waterlogged. So instead of like being able to come out, it's just going to be like causing your kidneys to be, again, waterlogged. What is deglutition? Process of swallowing. What does an enterostomal therapist do? They're a consultant for someone with like an ileostomy. Those people are great. Call them if you have the availability to call them with a patient that has one of those. What is the preferred test to detect cholecystitis or gallstones? Ultrasound. Sorry if you didn't hear me. You are doing a teaching plan for a patient with canker sores. What's an intervention? Silver nitrate works really great on those. Know where renin is made and its principal function. Again, the RAA system. Quick test tidbit, there's a select all that apply, and just know that renin is made in the kidneys. It helps regulate water balance, which means blood pressure balance. It promotes sodium and water retention, and it increases kidney filtration and blood flow. And then the next question is, where is aldosterone is made? Again, it's made in the adrenal gland, and its principal function, it's pretty much the same as the other one. So just check out the RAA system, okay? What specific gravity of urine? 1.010 to 1.025. And then just know that anything higher is dehydrated. So like 1.03 is dehydration. And like for 1.005 is like overhydration. There are many tests to check for kidney disease. What is the name of one test? Creatinine clearance is a great one. Check page 1620 in your book. What does BUN stand for? BUN stands for blood urea nitrogen. So urea comes from your liver when it breaks down proteins, and then your kidneys filter the urea out of your blood into your urine. And if it's not working great, if your kidneys aren't working well, then the urea is going to build up in your blood system, and that's called azotemia. Okay, compare and contrast the presenting symptoms of glomerulonephritis versus pyelonephritis. Glomerulonephritis is a slow onset. It's usually an immune response from something else like a strep infection, and since the glomerulus are like your filtering process in your body, it won't be able to process things or filter things very well. Versus pyelonephritis, it's very fast onset, it usually begins like as a UTI, like a bacterial infection, so E. coli is a big one, and then just travels right up the passageway. And usually you have like a fever, it's pain, you're nauseous, all the above. What is pyloric stenosis in a newborn, and what is the main symptoms? You're going to see projectile vomiting, and it's the opening between the stomach and the small intestines is going to thicken, which isn't going to allow that passage. So instead of things going where it's supposed to go, it's going to go right back up, like projectile. Okay. What are the three functions of lymph? It helps with immunity, it helps carry fats around your body, and it drains interstitial fluid. What's the relationship between red blood cells, hemoglobin, and hematocrit? I'm not asking you that question, but it's good to know the relationship. Erythropoietin is made in the kidneys. Again, we talked about that. Name of the genetically engineered erythropoietin, epogen. What are the 4 liver plasma proteins? You have albumin, you got fibrinogen, prothrombin, and gamma globulin. So write those down. Again, albumin, fibrinogen, prothrombin, and gamma globulin. And tell me what are the functions of those, okay? You can look those up. Immature red blood cells are reticulocytes. Medical word for platelets is thrombocytes. All salvage red blood cells recycle their iron where? In the liver. B12 is a deficiency. What is that a name for? Pernicious anemia. What vitamin is folate? Folate, B9, super important for pregnant women to get that. You can look that up. PMNs go up with what kind of infection? Bacterial versus lymphocyte is viral. Viral. Okay, what white blood cell goes up with parasite infections? Eosinophils. Vitamin K is produced in the large bowel by bacteria. So when you eat, that's when vitamin K is like getting produced. Define hemostasis. Stop bleeding, your body's normal. Lymph is moved around in 2 ways, name them. I'm going to give you way more than 2 ways. It's moved by like skeletal muscle when you're walking around, change in intrathoracic pressure when you're breathing. The smooth muscles in your lymph as well. They move through one-way valves, your pulsing arteries. Basically, everything helps move lymph in your body. Things that can cross the blood-brain barrier include caffeine, nicotine, glucose, oxygen, alcohol, hormones, lipid-soluble drugs. Okay, what's a normal white blood cell count? 6 to 10,000. Name two, next page. Okay, what does an elevated sedimentation rate represent? It can represent inflammation, it can represent infection. Okay, so what are you going to do with somebody with polycythemia? They have too much blood in their body. You're going to just drain it by getting rid of their blood. What do you do? What method do you do in IM iron shots, so intramuscular? It's the Z-track method. So you're going to pull back the skin, give the shot, hold it there, take it out, and then put the skin back. Z-track. Name 2 things that happen to white blood cells in the bone marrow when you have leukemia. We did not watch that YouTube video. So what happens is there's an increase in immature cells and an increase in reproduction of those. It's okay. What's a normal platelet count? 250 to 500,000. Certain cells seen under a microscope when you have Hodgkin's leukemia, is Reed-Sternberg cells, whereas bile and pancreatic enzyme enters the GI tract and from the duodenum. Barrett syndrome, that's when you have, it's like when you have like the hydrochloric acid from your stomach constantly going up right there in your esophagus, causing that change in cells, which is then going to like change the outline of your esophagus. So they take the esophageal cells, take the characteristic of gastric cells, so that's kind of what's going on. Part of the small bowel where most of digestion takes place. The duodenum is where most of digestion takes place, versus the jejunum is where absorption takes place. What are 3 functions of the large bowel? It helps reabsorb water, helps remove waste, and it helps make vitamin K. Okay. Function of the gallbladder. It stores bile. Define peritoneum. It's the sheath over the abdominal organs. Breaking up of long chains of fatty acids is called emulsification. Intrinsic factor is needed to allow B12 to be absorbed in the gut from food. Bacteria, a bacteria that can cause GERD, Helicobacter pylori. What's the serum value that goes up with pancreatitis? Amylase. What does TPN stand for? Total parenteral nutrition. And why do you give it? If they can't eat or if there's something wrong with their gut. Do not worry about dumping syndrome. I'm not going to ask you about it on the test, but it's good for you to know in general. Define dehiscence. It's when your incision opens up. Define evisceration. It's when the incision opens up and things spill out. So what are you going to do if you find somebody that's dehisced or eviscerated? You're just going to try to get a normal saline, get some gauze, pour some sterile normal saline on there, and just cover that wound up and call for help. Call for the surgeon right away. Okay. Define an A&P surgical procedure. So it's an abdominal perineal resection, and that's where the bowel, the anus, and the rectum are all removed. What organism causes monoliasis? It's a fungal, and it's Candida albicans. What is achalasia? It's the stricture, the GE sphincter, so food can't enter the stomach. So it's the sphincter between the esophagus and the stomach. Define hernia. It's the weakness in the muscle wall, the abdominal wall, or your gut's gonna come on out. What do you call the emesis of a person that is having a stomach hemorrhage? Coffee ground emesis. Okay, what is the action of a proton pump inhibitor? It inhibits the... Sorry, it's like 2 in the morning and I can't sleep. My baby's sleeping. Okay, so proton pump inhibitor, it inhibits the production, like the acid production in your stomach, and protonics is the name of it. So that's what that is. You can look more of it up. Action of an H2 blocker. It inhibits the histamine 2 blocker, and it's needed for also for the acidity and everything like that, and Pepsid as an example. Sorry, really bad explanations. Just look it up and have a general idea. How do osmotic cathartics cause bowel elimination? It helps increase the water content in there to help pass stool. Define volvulus. It's the twisting of the small bowel. Symptoms of fecal impaction, obviously constipation, and just know that even if you're constipated, you can still get like little watery bits coming around it. So even if it's like they're passing bowel, like they're passing stool, it doesn't really mean that they're actually like not constipated. What's the functional unit of the kidney? Nephron. Action of aldosterone, we already talked about it. Bladder muscle that contracts to initiate urination is detrusor. Detrussor. The serum blood value that goes up with liver disease, ammonia. Action of ADH, we already talked about it. You know about the RA system. Define glomerulonephritis and usual causes. I think we already pretty much talked about it. It's just the inflammation, slow onset, usually from an immune response, blah, blah, blah. What is hydronephrosis? There's a blockage in the ureter, causing the backup of urine into the kidneys, and then causing a really bad kidney infection. Okay, describe the pain of a kidney stone. Again, like I kind of talked about from like the chapter, colicky. Think of like a colicky baby. You can't just settle them at all. Like nothing is going to help them. Same with a kidney stone person. Nothing is going to help them besides pain control. Versus a colicky baby, you just have to give them love. Okay, the kidney tumor in children is called a Wilms tumor, WILMS. The first sign of bladder cancer is usually blood. The main dangerous complication of doing a home peritoneal dialysis is peritonitis. 3 things seen on a UA that makes urine positive for infection includes nitrites, white blood cells, and leukoesterase. Okay, those are all the questions. Let me know if you have any questions though. You know how to get a hold of me. Just email me, call me, blah, 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 blah. Anyways, I hope you guys found this helpful. If you didn't hear me, please just let me know and I can redo it. Thanks guys, bye.